Today, our presentation's topic is going to be drug nutrient interaction in clinical nutrition. First of all, we chose this topic because our co-op field placement, we all of us are working in a long-term care home, in different long-term care homes to be specific. And we see a lot of residents and patients receiving modified diets, particularly designed for them. A lot of drugs, that is medications, prescribed for various conditions. And we've always found it curious how far has this drugs been effective in while taking on a day-to-day basis and with comorbidities that the residents have. So let's go ahead and see in detail about the drug nutrient extraction.
Encounterment of drug in the body. I'm Masam, and today I'm going to discuss a topic on drug nutrition interaction. To begin with, the definition of drug nutrition, it is a change in the absorption, metabolism, utilization or excretion of drug or nutrition element due to introduction or encounterment of drug in the body. It is not only common in all type of people, but it is mainly affected or crucial for the one with the decreased physiology or older people. There are four types of drug nutrition interaction: ex vivo bioinactivation, which is an direct mixing of drug and nutrition interaction forming an biochemical reaction, hence leading to inactivation of nutrients. It can be confirmed by three main techniques: visual inspection, which involves visual changes; light contrast, with the help of light, we observe the alteration; rotation viscometry is the change in the viscometer of the drug or nutrition. Second method is the effective of meal intake on absorption. Drug absorption are usually affected by factors such as transit time, bile flow, dose, time, and consumption of milk. Well, the transit time is the speed at which the substance or meal travels through one digestive system, hence influencing the absorption. Bile flow is a secretion which is very important for digestion, hence affecting absorption. Doses, the dose at which drug has been provided. Time and consumption composition of meal is time and quality and quantity at which meal has been provided. Thirdly, we have altered absorption of drug and nutrition due to enzyme. Well, these commonly say there is some process such as transportation of ion, nutrition, and drug affecting absorption. A transport mechanism occurs due to concentration gradient, so that if concentration of drug and nutrition decreases, process also decreases. There a famous enzyme which helps in metabolization of in epithelial tissue is cytochrome P450. Induction and inhibition of this enzyme depends on bioavailability of drug. Fourth kind of interaction is interaction between internal feeding and drug. This is a very common method of feeding a drug or nutrition. One of the example for this is internal feeding tube. It is said that in a theory that warfarin and tetracycline as an oral absorption decrease with an increasing vitamin K absorption, creating concerns for the people. Later, this theory was proved wrong by few of the scientists. Later, a well documented example of drug nutrition interaction was antipyretic agent and internal feeding formulas. There are five main processes through which drug and nutrition interaction are processed. First one is chelation, that is some substance in ethanol feeding formulas may form complex with drugs, hence affecting absorption. Bioinactivation is the mixing of drug and nutrition leading to chemical formulation, hence affecting absorption. Change in the pH is the change in uh, acidic or basic form of the gastrointestinal environment. Alteration of gastric transit, the speed at which substance move. Lastly, binding of phenotoxin to casein or protein is a kind of protein interaction with phenytoin, hence affecting absorption. Later, now we are going to talk about a management skill for clinical aspect to avoid drug nutrition interaction. One of the three common principles to manage drug nutrition interactions are identifying, which is identifying the kind of interaction that has occurred, determining dose, which means doses adjustment, which are crucial for balancing the therapeutic benefits, determining alternative treatment. Considering alternative treatment might be necessary to circumvent potential interaction. Next, understanding some mechanism will help facilitate option for management. This involves type 1 interaction can be avoided by mixing in the same devices. Type 2 interaction can be avoided by administration time at what time the drug and nutrition were delivered, changing route of drug delivery or use of alternative agent. This involves using a different route for drug administration other than oral feeding. Implementing computer software to facilitate identification and advanced technology used to enhance our ability to identify potential
So now, let's see about the prevalence of drug nutrient interaction in the elderly. Several drug nutrient interactions can occur, but their prevalence may be attenuated in the elderly. Geriatric patients may experience age related changes in the pharmacokinetics of a drug, like absorption, distribution, metabolism, and excretion. When drug nutrient interaction occurs, they usually have a effective absorptive process more frequently. At the beginning of the century, it is estimated that about 25% of the people in the US lived beyond 65 years. While exact longevity figures may vary worldwide, providers of healthcare are challenged to ensure adequate nutrition and medications while prescribing a diet, either a diet or medications for respective conditions. It is also estimated that two-thirds of patients aged 65 years and older use one or more drugs daily. So, while alterations in the rate of drugs absorption caused by the ingestion of food may be clinically insignificant, changes in the extent of drugs absorption can be lessen its pharmacological actions. With aging, several important physiological changes occur that affect drug metabolism as well as result in an increased susceptibility to drug reactions. Several physiological changes that accompany aging may alter drug metabolism. Aging can lead to physiological changes that affect pharmacokinetics of a drug. Pharmacokinetics include a drug's absorption, distribution, metabolism, and excretion. Often overlooked in the GI absorptive process are the carrier or transporter system used by various classes of pharmacological agents. Carrier mediated intestinal absorption of various nutrients, including amino acids, peptides, sugars, and even water soluble, fat soluble vitamins, undoubtedly plays an important physiological role in determining the degree of absorption of these nutrients. But it is also affected by the concomitant presence of different drugs. Very little is known about the aging process that does to these carrier systems, but presumably they become less efficient in the elderly. This lack of awareness is due to the very less researched and evidence-based researches that has not been evident yet. Changes in pharmacodynamics are primarily seen in the cardiovascular and neuroendocrine system. So we also try to cover some of the most commonly used drugs like antidepressants, birth control pills, cholesterol controlling agents, oral hypoglycemic drugs, etc., and their effect on nutrient interaction with a regular diet. For example, diuretics like microzide, aldactone intake with fish oil, which is rich in omega 3 and several other nutrients, decrease calcium excretion, leading to hypercalcemia and depletes the absorption of hypercalcemia, which in turn leads to kidney stones and kidney failure and depletes the absorption of potassium, magnesium, and folic acid. And one of the most common drugs consumed is acid suppressing drugs and antacids, which depletes calcium, iron, vitamin B12, magnesium, and vitamin D when taken on a long term basis. It is common that uh, uh, most of the drugs, even the supplements, have the potential to have a detritive effect on the uh, uh, most of the drugs, even the supplements, have the potential to have a detritive effect on the metabolism and other um activities in the body when taken long term and taken without proper awareness or prescription of a certified physiologist. So it is always necessary to take the prescribed medications with proper advice. So the conclusion is
There has always been a question on how drugs interact with nutrients in the body and how short and long term courses of drugs can always affect the body in the long run. Drugs can act as anti nutrients, causing deficiencies in essential nutrients. This happens in several ways. Firstly, drugs can alter the intake of nutritious food consumed by an individual, meaning drugs can often lead to loss of appetite. One good example of this is when an individual consumes antibiotics and when one goes through chemotherapy. Secondly, they can also interfere with absorption of nutrients in the body. Drugs can even affect metabolism and utilization of nutrients in the body. It could cause malnourishment. And lastly, drugs can also affect the removal process of these nutrients, which could lead to excess accumulation of nutrients and could be fatal. Furthermore, prescription of drugs should always consider the cost course benefit ratio, meaning long term courses of drugs can lead to serious implications and could cause irreversible damage to the body, while short term courses may not be as harmful as the long term courses of drugs. Now, moving on to methods and materials used in this study. The research was solely based on literature search on drug nutrient interaction, which included sources like several books, Medline, and even Google Scholar databases. Then the common general search terms used were drug nutrient interaction, drug vitamin interaction, drug mineral interaction. Furthermore, specific searches were also done for specific drug nutrient interactions, such as the ones mentioned below. Now, moving on to the results of the research, major revelation of this study was that drugs can cause hormonal imbalance in the body and can also cause destruction of good and beneficial gut bacteria and could cause harm to the body.
conclusion is though there are not enough evidence based results regarding drug nutrient interaction on a significant scale, the need for healthcare providers to be mindful of potential drug nutrient interaction is an important as advising diet and medications for the respective patients' conditions, especially in the elderly population. Due to their increased vulnerability to adverse effects is significant while prescribing any medications. Currently, with the increasing awareness among people on the importance of mindful eating and importance of diet, there are researches underway on numerous topics like drug nutrient interaction, brain nutrient interaction, etc. Thank you. Hope it was useful.